Hi there, I am Mark Bailey Jr. from the Bailey Group, and the open enrollment period for health insurance is officially over. That wrapped up on March 31st. Today is April 1st, and you can see a huge difference on HealthCare.gov. We were used to seeing a big, hey, enroll now button. Now that's changed to see if you can still get coverage. And you definitely still can get coverage right now. The government put in place an extension for individuals who might have had problems enrolling on HealthCare.gov or problems of any kind getting health insurance. They're going to allow you to apply on healthcare.gov all the way up until April 15th. That is the last possible day to avoid a penalty and take advantage of this special enrollment period. So what I'm going to do is show you how to take advantage of this. It's actually really simple. There's no extra buttons or extra codes you have to put in. It just kind of recognizes this special enrollment period until April 15th. So let's jump into it. So we're on the healthcare.gov home screen here, and I'm going to have you look on the bottom of the page where it says Health Insurance Blog and click Open Enrollment is Over. And you'll see what I'm talking about. It says, if you had issues, don't worry, you're still able to get covered in 2014. Just log into your online marketplace application. Now, I thought that you would have to maybe have an application already in process, but that's not actually the case. So what I did to test it was I went in and created a totally new account. So went through, typed in all my information, picked a username. I'm just going to kind of zoom through this just so you guys can get a feel so you don't have to sit here for the full 20 to 30 minute account creation process. Get the password in there. Click next, do my little security questions, skip through this. Okay, so the totally new account is created. I got the email about 5 minutes later and my personal email address to confirm the account. And then I went back to healthcare.gov, clicked login, and typed in my new username and password. And so this is the screen you should see if you're trying this now. You'll see terms and conditions. Just accept those. Read through it first, of course. And then it says, hey, Mark, what would you like to do? Do you want to apply for new coverage? But please note the open enrollment period is now over. But again, we're in a special enrollment period where if you had issues enrolling, you are able to take advantage of this until April 15th and apply right now. So you'll see in that little, it's kind of like a light grayish box under individuals and families. You're going to click apply and shop for coverage for me or my family. And so you're going to start the application process. Now, this takes about 20 minutes. You have to put in a lot of different details. Social security number, they're going to see if you qualify for a subsidy. All the information that would typically be required for an enrollment process is there. This is not changed at all if you've done this before. So I'm going to skip through this just so you don't have to sit through that with me. So now that my identity has been verified, you're going to go through the actual application process, which will take you about 15 or 20 minutes. So make sure you devote that much time if you're going to sit down and do this. And we're going to skip it, like I said, but I did go through this earlier. And this is the page you'll see after you complete the entire application, your eligibility results. So it says, I am qualified to purchase health insurance. So you'll want to view them because that's a PDF that healthcare.gov outputs for you that you'll want to save for your records in case you ever need them. And I'll show you my PDF that they printed for me just so you can see what it looks like. Click view eligibility results. And I just want to show you where it talks about the special enrollment period. So we'll zoom in here. It's right on the second page. It says you're eligible for a special enrollment period to enroll in a health plan through April 15th, 2014. This is because you tried to enroll in coverage through the health insurance marketplace or Medicaid or CHIP and you had issues. So if you miss that deadline, you are in trouble. You cannot get health insurance again until November 15th or through another special enrollment period, which you'll get, if you had a baby or if you lost your job, you had a significant financial change, things like that. So we'll close out the PDF and click continue to enrollment. And this is the page you'll see where it says you're not enrolled yet. Here's your to-do list. And it talks again about open enrollment has ended on March 31st, but you probably tried to enroll and you had issues. So we're going to allow you to continue through until April 15th. So there is no box you have to check. We originally thought there was going to be some blue box that you had to check to say, hey, I did try. This is an honor system. So if you need to take advantage of it for whatever reason, This is your opportunity to get covered if you miss that March 31st deadline. And again, it's the same enrollment process as before, just with this extra box that says, we're going to give you more time because you probably had issues. So there you go. That's what it looks like. If you have any questions, you can leave them on the bottom of our blog post on mbaileygroup.com. I am Mark Bailey Jr. from the Bailey Group. We do health insurance, benefits, and financial strategies in St. Augustine. If you need any help with your health insurance for stuff like this, go see an agent or broker. I totally recommend that because they're there to answer questions for you when they come up. If you have any problems or issues, they're there. And they don't cost any more than if you did it by yourself. Health insurance prices are regulated by law. So take advantage of your local agent. That's what we're here for.